What differentiates a good doctor from a bad one?
A doctor has to have good communication skills, because this is important, for them to be able to work effectively within their team, especially in things such as handovers, to be able to relay all the information clearly, concisely and accurately. This reduces patient error and improves patient safety overall. I think a bad doctor would, on that note, would, their communication could be quite poor, and then there might be, misunderstandings in the information that's being relayed. Again, it's also important to have the communication skills when you're talking to your patients. So they have to be able to understand what you're saying. You have to reduce medical jargon, talk on the patient's level of understanding. Say if they don't have much medical knowledge, you've got to try and reduce that down to a minimum, to a level that they can understand. But whereas if the patient had a high level of medical knowledge, you could again talk on that level and just ease the patient, maximise their understanding. I think another quality is just reinforcing the point before, good teamwork skills. So the doctor has to perhaps be flexible in the way in which they work, because there's different environments within the hospital. So for example, in foundation year, you rotate on different wards. You have to have that ability to adapt to new wards every few months. Whereas a doctor which might not be able to do this as well, that might be deemed as sort of a less desirable quality. Another factor of that, again, it has to be sort of emotional resilience, and just the ability to have that stamina to work within the medical environment, because it's quite stressful. So a good doctor might have ways of being able to cope with this, being able to have that emotional resilience. So it could be sort of having things to relax outside of work, so maybe sort of playing a sport or sort of playing an instrument, maybe having other activities such as like art or going walking, and it's just having those things just to be able to go home and sort of relax and take the time to wind down from your day and not carry all that burden of the work and anxiety of what might have gone wrong or what could have happened with you of an evening. So to be able to sort of talk to family, maintaining that confidentiality whilst doing so, that could show a good doctor being able to sort of reflect but not carry the full burden. Whereas a bad doctor, it might lead to burnout if they're constantly working, not having things to be able to relax and wind down with, which again, that could detriment patient safety in the long run.